Hey, Dr. Coates here. Welcome to the Coates classroom. Today we're going to talk about tinnitus. So what is causing the ringing in my ears? We're going to talk about some causes, research, and treatment options. Tinnitus is pronounced tinnitus or tinnitus. You'll hear a lot of audiologists say tinnitus. When you say tinnitus, it sounds like the itis part is an inflammation, and tinnitus is not necessarily an inflammation of the ear. The definition of it, it's an umbrella term, so it can cover any kind of sound in the ears or the head. For some people, they'll report to us it's a ringing, buzzing, crickets, whooshing, pulsing, any kind of sounds in the ear or the head. It can be constant, or for some people it comes and goes. You are not alone in this. The statistics show around 45 million Americans have tinnitus, and there is a high incidence rate for over age 65. 26% of people who experience tinnitus report that it's a constant sound, so there are many people that do experience this phenomenon. What is the next step? So if you are just starting to notice tinnitus or you've had it for many years, we do typically recommend to start with an audiologist. We will perform a comprehensive hearing and tinnitus evaluation to help determine the cause and then also the treatment, as well as any kind of prevention over the years from it getting worse. So we go through all the different parts of that evaluation with you. The number one cause of tinnitus, however, is hearing loss, which is why we start with that comprehensive hearing evaluation. For many people, the tinnitus has had an initial event that caused it, and for many patients, it is hearing loss. The inner ear, there can be some damage caused by many different factors that initially triggered the tinnitus sound. Tinnitus is something that is produced at the higher pathways in the brain, but can initially be caused by some damage in the inner ear, such as in this anatomy chart here. You'll see on the top right there the inner hair cells and outer hair cells within the inner ear fully functioning. At the bottom there, this was somebody who's exposed to really loud noise over many years, showing that there has been some damage. So causes, like I just mentioned, loud noise exposure. For some people, it could just be wax or fluid or pressure in the ears. For some people, it's the aging effect on the ears, the way those hair cells change over time. Some people, family history, genetics is linked with hearing loss. For some people, the ringing, buzzing, crickets, whooshing, any kind of tinnitus sounds may have started following medication or chemotherapy, radiation. There's also many different inner ear disorders and diseases that cause it too. So we're able to evaluate to see what may have caused it for you. Other linked health conditions as well that are linked to hearing loss as well as tinnitus are diabetes, cardiovascular disease, thyroid, kidney, cancer treatments like I mentioned in the previous slide, migraines, headaches, and then also jaw, TMJ, or temporomandibular joint disorder too can cause tinnitus as well. So we do collaborate with a lot of different physicians with tinnitus, with a patient who has tinnitus, so we can help determine maybe there's a multi-factor approach to it as to what we recommend for treatment. What are the treatments? So it depends on the cause. Some people, if they have underlying hearing loss, one of the best research-based treatments for tinnitus is the use of hearing aids. So we're getting that stimulation on the hearing pathway again. So many patients report a reduction in the tinnitus perception with the use of hearing aids. So again, there's not one official cure for tinnitus, but there are some treatment routes. There may be some answers that we can get for you and some treatment options as well. Other treatments besides hearing aids can be certain masking devices, white noise machines. There's also different types of applications for smartphones depending on the type of tinnitus you have. So we go through all of that at the tinnitus evaluation with us as well. There's also some cognitive behavioral therapy that has shown to help with tinnitus and the perception to the patient of the tinnitus. So we also walk through that if needed. Lifestyle modifications, some things to watch for tinnitus that can trigger it through the day: caffeine, alcohol, tobacco, stress, sleep, sodium. So just some things to watch for if you notice your tinnitus fluctuate through the day. Like I mentioned before, cognitive behavioral therapy may be another approach. There are many clinical trials right now for patients who experience tinnitus, so they're still working on a cure, still trying to find some different therapies that may help reduce that perception of tinnitus. So there's a lot of hope out there, a lot of research that's focusing on this right now. So we've been keeping up with that to see what will be the next step for tinnitus in the future. Overall recommendations: definitely make sure you are following up regularly with your primary care or other specialists, such as a cardiologist, physical therapist. There's many different causes, so we want to make sure your overall health is being followed. We also want to treat the hearing loss first if there is underlying hearing loss, which we'll determine with the initial visit with us. And overall healthy and active lifestyles always recommended. And then of course support from others, so making sure that you have a good support system around you when you're experiencing something like this.